Always feel tired and thirsty? You can have diabetes and not know it. Could you be one of the staggering 8.7 million Americans unaware that they have a dangerous chronic disease? In this episode, we'll examine the symptoms that indicate undiagnosed diabetes. And if you watch until the end of the video, I will introduce you to a device that may be a game changer in actively managing blood sugar levels in diabetics and non-diabetics alike. Hi again and welcome back to my YouTube channel, Dr. Hanz MD, where we 10x your success by optimizing your health. According to the American Diabetes Association, diabetes is the fastest growing chronic disease in the world, and a 2021 report by the CDC shows that about 38.4 million Americans have diabetes, roughly 8.7 million of whom live with undiagnosed diabetes. Diabetes is a chronic condition that affects how your body regulates sugar. Normally, your body uses a hormone called insulin to unlock your cells and allow glucose to enter for energy. However, in people with diabetes, the body either doesn't produce enough insulin, a condition called type 1 diabetes, or the cells become resistant to insulin, a condition called type 2 diabetes. This leads to high blood sugar levels, which can damage your body over time. Studies show that it can take a whole decade before someone can get diagnosed. If left untreated, diabetes can lead to serious complications like heart disease, stroke, kidney disease, nerve damage, and even vision loss. We can change that. Awareness is paramount. By catching diabetes early and managing it effectively, you can significantly decrease your risk of this complication. As many of you know, I'm passionate about empowering people in taking charge of their health. So today we're kicking off a new series focusing on blood sugar control. Throughout this series, we'll talk about the various aspects of blood sugar control. Today, we begin with the crucial first step, and that is recognizing the symptoms of diabetes. By understanding the signs your body might be sending, you can be proactive about seeking medical advice and getting a diagnosis. So let's examine some of the most common symptoms that may indicate diabetes. Number 5, a cycle of excessive thirst and frequent urination. When your blood sugar levels are high, your kidneys work overtime to filter and remove the excess glucose from your blood. This process pulls water out of your body through urination. Your body then signals thirst to replenish the lost fluid, creating a cycle. You'll likely experience frequent urination, especially at night. This can disrupt your sleep and make you feel tired throughout the day. Number 4, a change in body weight. In type 1 diabetes, the body doesn't produce enough insulin. Insulin is needed for transporting glucose from the bloodstream into the cells, where it can be used for energy. Without sufficient insulin, cells cannot access glucose effectively. As a result, the body turns into alternative energy sources, such as stored fat and muscle tissue. This process contributes to weight loss. In type 2 diabetes, cells become resistant to insulin's effect. Insulin is essential for glucose uptake into the cell. When resistance occurs, glucose remains in the bloodstream rather than entering into the cell. The body perceives this as an insufficient energy supply, leading to increased hunger, prompting increases in food intake. The cycle perpetuates, leading to weight gain and potential complication. Number 3, constant fatigue. Fatigue refers to the overwhelming and persistent feeling of tiredness, weakness, and lack of energy. When associated with diabetes, it can significantly impact daily life and overall well-being. In diabetes, blood sugar levels can fluctuate significantly. High blood sugar or hyperglycemia occurs when the body cannot effectively use insulin or when insulin production is insufficient. Low blood sugar or hypoglycemia can result from excess insulin or inadequate food intake. Both hyperglycemia and hypoglycemia contribute to fatigue. Hyperglycemia affects energy production and leads to dehydration. Hypoglycemia deprives cells of glucose, causing weakness. Number 2. Blurred vision. Diabetes can affect vision in a few ways. High blood sugar can cause the lens of your eyes to swell, altering its shape. An altered lens shape leads to blurred vision. As your blood sugar levels fluctuate, your vision may likewise vary throughout the day. High blood sugar can also decrease the production of tears and make you have a feeling of dry eyes. This can cause discomfort and blurred vision. Tears play an important role in maintaining clear vision. Diabetes can put people at a higher risk of developing cataract. Glucose attaches to lens proteins, accelerating cataract formation. Cataracts clouds the eye's lens, causing blurry vision. Regular eye exams are essential. If you notice any changes in your vision, consult an eye specialist right away. And number 1, wounds that are slow to heal. Cuts, scrapes, and bruises, or surgical incisions take longer than usual to heal, are common concerns for individuals with diabetes. High blood sugar levels can damage blood vessels and reduce blood flow to tissues. Poor circulation delays the healing process. Adequate blood circulation is essential for delivering oxygen, nutrients, and immune cells to the wound site. Diabetes can also lead to nerve damage, which reduces sensation in affected areas of the body. This can make it challenging to detect injuries immediately. Unnoticed wounds are likely to be left untreated for some time. Elevated blood sugar also weakens the immune system's ability to fight infection. Infections at wound site hinder healing, and the inflammation further delays tissue repair. That's the rundown on the key symptoms of diabetes. Should you experience one or any combination of these, see your physician promptly. However, I would like to highlight that some diabetics may not show any of the signs included in the list at all. Whether or not you have any of these symptoms, the American Diabetes Association recommends diabetes screening every 3 years starting at age 35. For some, this recommendation starts earlier, particularly if you're overweight, lead an inactive lifestyle, or have a family history of diabetes. If you currently have or have a history of gestational diabetes, prediabetes, HIV, high blood pressure, abnormal cholesterol levels, polycystic ovarian disease syndrome, heart disease, discuss diabetes screening with your doctor. In addition to watching out for symptoms and recognizing risk factors, you can consider using continuous glucose monitors or CGM. CGM as a proactive tool. There is definitely an increasing interest in these devices even in non-diabetic. CGM allows you to see how your body reacts to different activities and foods in real time. This information can be incredibly valuable in helping you make adjustments to your diet and activity level to keep your blood sugar in a healthy range. Most importantly, CGMs can also flag any fluctuations in your blood sugar levels that might warrant further evaluation by your doctor. If you found this video informative, please share it with your friends and loved ones. By spreading awareness, we can help each other stay at the ready against diabetes. Stay tuned for the upcoming videos in this blood sugar control series. We'll see you at the next episode of Dr. Hanz, MD, where we 10x your success by optimizing your health. You can prevent or delay serious complications associated with diabetes when it's caught early. So stay vigilant.